Good afternoon, everyone, and welcome. My name is Courtney Goodwin. I am the social media manager at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for another Facebook Live Town Hall. September is National Food Education Awareness Month, which is a great time to bring awareness about foodborne illnesses. The federal government estimates that there are about 48 million cases of foodborne illnesses annually. That's about 1 in 6 Americans each year. So today we have two of our Prisma Health experts that will answer questions to bring awareness about food safety. So today we have Dr. John Manna. He is an internal medicine physician in the Midlands. And we also have Lindsay Kirkland, Supervisor of Clinical Nutrition Services in the Upstate. So thank you all for being here today. So let's go ahead and get started with our first question, which is going to go to Dr. Manna. All right, our first question today is, what are some common foodborne illnesses?
Yeah, so there's a lot of foodborne illnesses. You have bacteria, viruses, parasites. You can even get like yeast and things that can infect the food. Some of the common ones you might have heard of before would be like norovirus, salmonella, Campylobacter, E. coli is a common one. Even hepatitis A are all different illnesses. They all have different treatments. All can be contaminated in different foods. There's a lot of different common foodborne illnesses out there.
Thank you. So next we're going to go to Lindsay. Pop you up here. All right, Lindsay. So how do you know if you have food poisoning, and what should you do if you think you have it?
Yeah, so a lot of times it's really hard to know whether you're actually sick or you have food poisoning just because the symptoms are very similar. Common symptoms of food poisoning are going to be diarrhea, stomach pain, cramping, nausea, vomiting, and fever. The symptoms can last anywhere from a couple hours to several days. So what do you do if you think you have food poisoning? One, there's no way to essentially get tested for food poisoning. So if you feel like you ate something that probably caused this, report it to your local health department. So for us, that would be SCDHEC. Even if you don't know what made you sick, it is important to report it still. And otherwise, if not, if you want to go get tested to rule out things like the flu, or something that would also have the same symptoms, that's appropriate too.
Thank you. All right, we're going to head back to Dr. Manna. So the question we have for you is, what are some food safety rules we all should be following?
Yeah, so there's a lot of different food safety rules, and if you really look into it, depends on the different foods you're eating and preparing and where you're buying them from. But overall, what we really like to see is a couple of things. So one is to, the first step is clean. So make sure your hands are clean, make sure all the utensils and knives and anything you're doing to prepare the food is cleaned. And then make sure that you're not cross-contaminating. So meat products should not be next to fruits and vegetable products and bread products and all of that kind of stuff. So a lot of times it's suggested that you have a separate cutting board for some of these items, and you always want to make sure that when you're done that you also rewash the utensils in between cutting different foods. So if you're cutting one vegetable before going to the next, you really should clean all of your equipment before you move on to the next one. So the first thing is clean. The second one is separate, so using different cutting boards and things like that. The other thing is to cook the food properly. So the CDC has guidelines on what temperature each food should be cooked to. So I'm not going to go through all of them today because it depends on different type of meat and all that kind of stuff, but you can search it online at the CDC website, and they'll tell you each food and what it needs to be cooked to and what temperature. So that means that each person, you should have a working thermometer to check the temperature of different foods and make sure that's cooked appropriately. That will make sure that all the bacteria is killed off. And the last thing is storing foods, or making sure it gets chilled. So your refrigerator should be set to 40 degrees or below, and your freezer should be 0 degrees or below. And that's how we make sure that food is stored appropriately.
Thank you. That was great information. Next question is, what do the expiration dates mean on these packages of food?
Yeah, so there's a bunch of different expiration phrases that you'll see. You'll see like best if used by, sell by date, use by date, freeze by date. So a lot of times these are really just for processing and for stores. So knowing when they need to sell these foods. It actually is not a food safety date or regulation by any means. They're solely just for production. But the big thing to remember there is making sure that you're not consuming something that has like a foul odor or doesn't look like it quote unquote should. Um, that date really just indicates when these products should either be used, sold, or frozen by. Um, and then the other thing is just kind of looking out for spoilage. So if something does have a foul odor or does look like it's starting to go bad, um, just toss the food, don't use it. Bacteria can grow on it, and that bacteria is what can cause the foodborne illnesses.
Right. Thank you. All right, Dr. Manna, the question I have for you is, how long can food be stored in a freezer?
Yeah, so that question is twofold. From a foodborne illness standpoint, food can be in a freezer indefinitely. Once the food is frozen, it's below 0 degrees Fahrenheit. Essentially, the foodborne illnesses become inactive. The bacteria, the viruses, all that stuff, they can't grow. So it can last in the freezer forever. But, if you're looking at quality of the food, you probably shouldn't freeze food for forever because you're going to lose some of the quality. By no means am I a chef or a food expert as that goes, but there's different recommendations as quality for different foods, and the USDA and then foodsafety.gov are both great websites that will tell you as far as the quality goes, how long you should freeze certain foods for. But once again, as far as the foodborne illness, it can be frozen indefinitely.
Thank you. All right, so what are some safe ways to thaw food?
Yeah, so there are 3 safe ways to thaw food. The first one is to thaw your food in the refrigerator. So to move something from the freezer to the refrigerator and let it thaw at that temperature. Second way is running it underwater. Big thing here is making sure that whatever food you're running underwater is in a sealed packaging. So you don't want to like you don't want to open something up and run the food directly under that water. The water should also be cold. So you don't want to run frozen food under warm water. It's going to put it in this quote unquote danger zone for bacterial growth. And then the third way to thaw food is going to be in the microwave. If you are thawing foods in the microwave, just make sure that you are cooking them immediately after thawing them. You don't want to thaw in the microwave and then let it sit in the fridge for 2 days and then cook the foods.
Thank you for sharing that information. All right, so my question for you is it okay to eat raw dough or batter?
Yes. So although raw dough and batter might taste good, the answer is no, it is not safe to eat. A lot of people think it's just because of the eggs, and I don't know, a lot of people talk about salmonella and things like that. But one of the other contributing things you want to think about is the flour. So you should not consume raw flour. So it's not just like cookie dough and brownie batter and things like that that have eggs, but it's also bread doughs, and any type of dough you should not consume until it's been eaten, because the raw flour and the eggs can both make you sick from foodborne illness.
That's really good to know. I know people like to indulge in the raw cookie doughs before they put them in the oven. So thank you. All right, Lindsay, your question is it okay if you accidentally eat moldy food?
So this kind of depends. There are some molds that are harmful and some molds that aren't harmful. So certain molds can cause allergic reactions or respiratory problems. And other molds are actually can cause like a poisonous toxin in your body. So in general, if you see something moldy, don't eat it.
So a part two of that is if you cut around the mold piece or, remove moldy piece of the fruit, is that still okay?
Depending on the fruit. So if it is more of like a firm fruit, like an apple or a pear, cutting around that moldy piece and eating the rest of it is fine. Now, if it's a softer fruit, something that has a higher moisture content, you don't want to eat around a moldy part. Now, say you have like a package of blueberries or something, and you notice that 3 of the blueberries have mold on them and they're all kind of contained together. You get rid of all of the ones that have mold, the rest of them that don't should be fine.
So if someone loses power to the freezer, is things that thaw a little, is that okay to refreeze?
Things that thaw a little bit,
Mhm.
I would say it depends on how long you lose power to that freezer. So generally, rule of thumb, is frozen foods really need to it shouldn't be in that, like, quote, unquote, "danger zone" in terms of, um, temperature for longer than, like, 2 to 4 hours. So beyond 4 hours, I would say you need to toss it. If it's less than 2 hours, you should be able to refreeze it.
Okay, thank you. Dr. Manna, your question is it okay to reuse a water bottle without washing it?
So it depends on what type of water bottle. So if it is a disposable water bottle, 50 cent, $1 water bottle that you get at the grocery store and a pack of 36, technically no, you should drink it one time and then throw it away because it degrades the plastic and also things can grow in it. As far as reusable water bottles, so water bottles that people bring to work every day into the gym and they're meant to be reused, you should clean them out regularly. It's nice to get into a good habit of either putting them into the dishwasher at night or just washing them with your dishes at night before you go to work the next day or your activity the next day. And just make sure you are washing them with hot soap and water. And then the other thing you have to watch out for too is a lot of these reusable water bottles now have straws in them, and make sure we're also washing out the straws. You can get little tools and all that kind of stuff, like little brushes that are made for straws, and make sure you're using soap and water and using that as well because the bacteria can grow in the straws.
Thank you. So we have a question that came in. So how long can leftovers be kept in the fridge?
It's going to depend on what the leftovers are. So it gets really tricky when you're talking about food and how long it's stable and things like that. So something like meat is going to be probably not as long as something like fruits and vegetables. But at the same time, you're also going to have to look at the fruits and vegetables and see, are they spoiled? Are they wilted and things like that? So usually what I recommend to people is it depends on what the leftovers are, depends on how it was cooked beforehand. Was it already cooked or not cooked? Sometimes people, like a salad, you don't cook a salad, right? So it's going to be longer. So it depends on all those factors. So it's hard to give a clear answer as far as that goes. But I usually tell people, if you have leftovers, you really should be trying to eat them the next day or so, and they shouldn't really be sitting there too long. But once again, I mean, the USDA, CDC all have really good guidelines. And if you're looking about specific foods, you can just go on those websites and look up the foods, and it will tell you how long they're, stable in the fridge and the freezer and all that kind of stuff.
Well, since I have you up here, we have another question that came in. Should we be worried about storing food in plastic containers nowadays?
I mean, I think it's fine to store food in plastic containers. You're going to have, people who say don't reheat it up in plastic containers. So that's usually the issue. Some people prefer to, have it in glass. The biggest thing is you want to make sure it's sealed. You want to make sure you're not just putting stuff open in the fridge because other things can get on it. So if you have meat products and, meats have the juices and all that stuff, you want to make sure it's not dripping on your vegetables and stuff like that. So I'm not going to get wrapped up as much about the plastic and putting it in the fridge. It's going to be much more about the reheating with plastics. Also depends on what type of plastic it is, right? There's so many different types of plastics out there. But just making sure that nothing's getting cross-contaminated and that it's sealed well, because that will help with, freshness of the food, but also, to prevent foodborne illness.
Well, thank you. So Liz, we're going to go back to you. All right, so your question is, how long can food be left out of the fridge, like at parties or cookouts?
Good rule of thumb is 2 hours. So make sure you have a plan for when you want to eat at like a party or a cookout, so that that food doesn't sit out for too long. The other thing to kind of consider too is temperature. So if you are going to a football game and you're going to tailgate, and this time of year it can still be really hot outside. So any temperature higher than like 90 degrees, like outside at a picnic or at a tailgate, you want to make sure that that food is refrigerated within an hour of taking it out of the fridge. That kind of puts that in that danger zone. So good rule of thumb in general is 2 hours inside, 1 hour outside.
Thank you for sharing that. We have a question that came in. Are there safety concerns with cutting on wood cutting boards?
With wood cutting boards, there can be, because that wood actually does absorb moisture. So think about even like wood, like a wood outside, wood in a like table or something like that. If it's a humid day, that wood can expand and contract. So absorbing that moisture, and bacteria actually grows in those moist zones, moist zones. So make sure if you are using a wood cutting board that you are sanitizing it as well when you clean it.
Thank you. Dr. Manna, we have a question for you. Pop you back up here. Someone wants to know, if I get food poisoning, how long does it usually take to know? And will I get sick very quickly or hours later?
Yes, so it depends on what the type of food poisoning is, right? So most cases of food poisoning are very mild, self-containing, 24, 48 hours, you feel better. Usually you are going to get sick relatively soon after you eat, not 5-10 minutes afterwards, but a couple of hours to the next day after you eat, depending on what you eat and when you eat it. But there are cases where people do get hospitalized, salmonella and things like that can, depending on how bad you get a case, it can cause you to have to be hospitalized. So usually what I recommend, especially in the primary care world, that's what we're here for. So patients, you have, questions and concerns, and as we discussed earlier, it's hard to tease out, is this really food poisoning or is it something else? Because a lot of times flu or as people call it, a stomach bug, or a GI virus, gastroenteritis, stuff like that, all have very mimicking symptoms, and the treatments are relatively the same, but we need to check on some things, right? We need to make sure you're not getting too dehydrated if you're having really bad diarrhea or something. So I think the best course of action is, if you have symptoms or concerns, to just reach out to your primary care provider, or if you don't have one, I would advise you to get one, but if you don't, go to urgent care or something, and they can kind of assess your symptoms, assess your vitals, and see kind of your actual status, and see kind of where the next steps lie. But in general, 24, 48 hours and things usually resolve.
Okay, thank you. Well, I think that's all the questions that we have. Since I already have you up here, Dr. Manna, can you go ahead and give us, some few thoughts and just wrap up on the questions here?
Yeah, that's great. So as far as food safety goes, I mean, like I said, it's kind of difficult to say exact answers to some of this stuff. So, always use your resources. So USDA, CDC, all that stuff have great resources. So don't always believe, the myths that you hear, or because your neighbor or your parents or someone else told you that. So utilizing those websites to research specific things as far as temperature and storage and quality of food is all important. I always tell people too, like, we have, our gut feelings for a reason, right? Like if you look at something like that, food doesn't look good, or something just seems off, don't take the chance, just go ahead and throw it away. If you go out to a restaurant, just use those senses and just kind of know if something doesn't look right, doesn't smell right, doesn't taste right, then, by all means, please don't eat it. But because of that, I think that the most important thing is just having established primary care providers, because we can help kind of walk you through some of the stuff and kind of get you the care that you need. If you're having symptoms or concerns, we can tell you the right direction, because you can go on Google and research stuff, and you're going to get 15 different answers that can kind of help you guide you to the reliable sources, if that makes sense. So I think it's just a healthy thing to have a primary care provider, even if you don't have any chronic conditions or tons of concerns. It's helpful for each year just to get seen, and just to make sure, preventative wise things are good. And then when you have questions or concerns or something pops up, we're pretty easily accessible.
Thank you. All right, Lindsay, do you have any final thoughts?
Yeah, I mean, just to kind of reiterate what Dr. Manna said, when in doubt, throw it out. So if you have any food that you think might be bad, it's not going to hurt you to throw it away. Also, don't be afraid to report food poisoning. Just because you report it or you think you got it at your favorite restaurant doesn't mean that favorite restaurant's going to shut down. So just don't be afraid to report it. It keeps everyone safe and healthy. And again, like he said, just utilize your resources and make sure you're looking at a credible website when you are Googling or looking up things about your symptoms. Don't hesitate to reach out to your primary care doctor. These days we have a lot of really easy ways to do that, where you don't necessarily have to like run into the doctor's office. You can call or my chart message, or get some kind of virtual help also.
Yes. Since I have you up here, are there any tips for food safety when traveling to other countries?
That's a good question. I would probably go on and look up the big thing that you hear about is like water safety. So even though we think about food and food poisoning, water can also cause foodborne illness as well. So I know like you hear about the water in Mexico, like maybe don't drink that, maybe drink bottled water. So looking up water safety too, because you also have to remember that when you go to a restaurant, hopefully they're rinsing all of their produce. So even something like produce can get a waterborne illness as well. And a lot of the travel websites, when you're looking up different countries and what to know, they'll tell you about water safety and all of that too.
Thank you. All right, well, thank you to our Prisma Health experts for joining us today to answer questions about food safety and how to avoid foodborne illnesses. Thank you for everyone online for tuning in. If you have any questions after our live, please leave them in the comments. We will respond as soon as possible. Again, thank you for joining us for another Facebook Live Town Hall. We hope you have a great day. Bye-bye.